Hello, everybody, and thanks so much for joining us for this edition of Healthline 3. I'm Carly Flynn Morgan. Today we're talking about buttock enhancement with Dr. McIntyre Bridges of Bridges to Beauty. He'll be answering your questions for the next half hour, and we want to encourage you to ask what's on your mind. If you're watching online at KTBS.com, just submit a question there on the right side of your screen, or you can just give us a call. The number is 318-219-4569. It'll be there at the bottom of your screen throughout the show. We will be taking your questions until 12:30. Dr. Bridges, thanks so much for being here.
Oh, my pleasure.
So, a big butt wasn't always in style, but I think it kind of came around about 10 years ago with J-Lo, Jennifer Lopez.
Right.
I know she was the first actress in recent times to really be loved for her body, her curvy body, her big behind. And now with the Kardashians, it's something that's really in style. So are butt enhancements kind of a new thing that have come around, or have they always been around?
Well, they've been around. It's just that I think I've seen more of them in the last 3 or 4 years than I saw in the entire 15 years before.
Are there different ways to enhance your behind, and what are your favorite ways to do it?
Well, there's really two basic ways. One is an implant, okay, and that's been around for, 30 years or so. And then the other one is fat injections, where you're taking fat from areas of your body that you don't think needs to be there and putting them in the buttocks region to enhance the buttocks. The implants, like I said, been around for a long time. They caught on in a small fashion, okay. But with the advent of the injections, which is like your tissue, you're just transferring fat from one area to another area. This seems to be more appealing.
So when you take the fat from one spot and put it to another spot, you're specifically saying it has to be your own fat, correct?
That's correct.
So how much do you need to make a difference?
It really depends upon the size of the person. We were talking earlier, I said, 500 per cheek kind of situation. if you're small, then yeah, you can use less, like 300 or 200, and get a significant change. I find that women who come in are really two types. The Caucasian women, they really don't have anything. Okay, they don't have buttocks at all and things. They just go from the back all the way down to the buttocks, and it's flat. You can take some fat from their flank regions, okay, and start the upper portion of the curve of the buttocks, and then take that fat and put it into the buttocks itself, and that gives them a better shape. And then there's African American women. They generally, want to have larger buttocks. I find a lot of them have significantly large anyway and things, but they want larger, and it appeals to them and their culture. And it's in those you're probably using 700 cc's to a liter on each side. Yeah.
You were saying 300, 500, 700. Can you give us like a picture? I guess a liter. If you think of a 2 liter of soda.
Yeah. Well, this here, this little bucket thing I have, which we harvest the fat with, it's new, and again, there's certain things that appeal to me about its makeup. But this is 3 liters. Basically,
okay.
This goes 1,000, 1,500. It's about 3 liters worth of volume there, and you're talking about 2 of those 1 liter Coke bottles or quart bottles, and that would, like I said, that would significantly enhance a buttocks. You have to overshoot a little bit, because the problem with any fat injections, you're taking live cells, you're stripping it of all its blood supply and all its nutrients, and then putting it into an area that it doesn't have blood vessels to it yet, and it takes about 3 to 5 days for blood vessels to connect. So you're going to lose probably 20, maybe 30% of that volume and put in there. So you really need to kind of overcorrect. Again, the overcorrection doesn't look like it's gigantic. It's just, you just need to do that to get the final results.
And I'd imagine after the procedure you would be a little bit swollen, like after any surgery, mm-hmm. right?
Yes.
So it'll be significantly bigger than it would end up being.
Right.
Once it's all healed.
And what I found is you'll inject an area of the buttocks, or actually, say you inject the face or other areas that fat injections are commonly used, even the breast. We've used fat injections in the breast. It's not real popular, but it's available. The fat cells that you inject in there, they're really kind of little storage vehicles, and they'll lose portions of that fat, okay? And then when they're healthy again, then they'll start to take it up again. So there is a transition where you lose some, you have the swelling originally, you lose that swelling, and then you lose a little bit of that fat that's in the fat cells, and then it starts to come back. It's just that, if the fat cells been stripped from one place, put in another place, they're not real healthy. Okay, they're just not up to par.
What areas do people generally get the fat removed from?
From the buttocks region, I like to use the flanks, and then a lot of people in the buttocks region, since you have to have a significant volume, usually you need a couple of areas. Flanks are not uncommon, stomachs are not uncommon, lateral thighs. Any place they have fat that they wish to get rid of and things is acceptable.
Do you do that all at one time? Do you remove the fat and then put it in the butt, or do you, remove the fat, let someone heal from that procedure, and then do it later?
Yeah, really, you do it all at the same time.
Okay.
The reason being is that fat cell you took out, again, it has no blood supply, has no oxygen. It's not the healthiest cell in the whole world. Things you don't want to, freeze it or do things like that, and come back later and put it in, because you lose even more. So it's better just to harvest it and harvest it quickly. Keep it cool, wash it up, put it back in. And the quicker you can do that, the better off you are. That's why this little contraption is a blessing in that respect. Typically what you'd have to do before is either from a handheld lipo, extract your fat into, like these 60 cc syringes, and you'd have like a whole row of those things, and they'd be sitting on the back table. Again, you try to keep them cool, but it's difficult, and then you'll take it and inject it, and that just chews up time. Okay, the quicker you can get fat from one area into the final area, the better off you are, and the better the take rate.
So explain a little bit how it works for us.
Okay, all right. This will look like a regular liposuction cannula as far as the shape of it. The suction that goes to the patient, that you extract from, goes in here. Okay, the vacuum portion goes in here, and it creates, a suction so that fat can come in it. Okay, when you do that, when you get the fat in there, you need to wash it up, because it has blood in it, and then it has fat cells that are broken, so it's oily. And again, the more trash you can get out of it, the cleaner things are, and the better they take. And you'll pour some cool saline in here to wash it up, and this, hook it back to the suction so that it drains off that cool saline that you washed off all the debris with. And then at the bottom, you use this little syringe, and you'll fill the syringe up, put the little, we call it a tulip injector on there, and then inject it into the buttocks region.
How long have you had this device?
I've actually had this about a week or so.
Oh, yeah.
Yeah. So it's fairly new. It's called lipo filter, for lack of better words. I mean, that's the trade name for it. But it really will speed things up and just make it much more cost-effective and efficient in terms of cells that live.
That's great.
That's what you're after.
What is the pain level for this procedure? And do people say that sometimes can the pain be equal from the actual liposuction and the injection, or what is that comparison? It's
about the same. The area that you liposuction actually is more of a bruisey, stingy soreness. It's really not bad, but no one finds trauma to be pleasant. And when you take that fat and inject it into the buttocks region, it's a little sore. It's not as bad as you would think. In comparison, I think the areas that you extract the fat from, it's about time and a half sorer than what you find if in areas you injected it to.
When you inject the fat into the buttocks, do you how do you know where exactly to put it? Does it matter on the person if you put it to the side, on the top, below, and then does it go in with all the other fat cells that are in there?
Yes. I mean, here with those questions, the first one is, where do you put it? Well, it depends upon the shape of the original buttocks, because some can be more pyramidal shape or triangular shape. Some can actually be full there and then have a deficit out laterally. So you're just filling it to make a nice rounded butt with projection along the same lines as the pubic bone. Okay, that's where the projection, it shouldn't be low, shouldn't be high and things. It's usually along that region aesthetically. That's what all the studies will show. When you inject it, you're putting it in the fatty layers as well as down close to the muscle layer. And the muscle will have more blood flow to it, so the take rate is probably a little higher there. And sometimes you can actually inject it into the muscle. It doesn't change the function of the muscle, but that's another way to try to enhance the take rate.
That's interesting, because I think when you think implants, you hear about putting it over top of the muscle or behind the muscle. That's kind of something you can do with the fat as well. You can put it directly in the muscle?
Yes. Yeah, that you can. And most of it's going to go into that subcutaneous fatty layer that, it has blood flow to it, but if you ask the percentage of capillaries in fat versus muscle stuff is higher in the muscles.
How big do people generally want to go, and how big can you go?
Well, that's a good question. You could go, probably increase the size. If they're real flat things, you can actually double that size and get a nice shape to it. Like I say, some people come with the large buttocks to begin with. The larger it is to begin with, and the more you put in, it obviously gets bigger, but it's a relative situation. It's like if the ball's big, and then you put in half the size, it has to accommodate, underneath all that skin. So, they can go as big as they want. It might take a couple of treatments.
Is this always for vanity, or have you ever heard of a medical need to enhance your buttocks?
I haven't heard of a medical need.
I couldn't think of one, but I thought I would ask, because sometimes, there's something like that. I guess if somebody got into an accident and was misshapen, I suppose, from an injury, that would
you
work.
can do that. A lot of times they'll use little flaps back there. I've done that before. Gunshot wound to the buttock, it just took off things, and this person actually had lost part of his leg, so I took the leg and stuff and made him a flap on the bottom. They gave him the cushion and the size that they needed. But those you could do that. Imagine for breast reconstruction, they'll use fat injections too. In a radiated breast, it seems to work reasonably well in helping to restore, some of the tissue integrity. A radiated breast basically that tissue is damaged really for life. And when you harvest fat, you're actually harvesting not only fat but stem cells, which is a cell that basically can become any cell that you want in the body. And so if you inject it into a breast that's been irradiated, you can actually, instead of it being firm and hard, soften it up and improve the skin integrity, so that if you had to actually operate on the irradiated breast, it seems to be a little bit better.
I'm trying to can you just push that to your left, doctors? They'll get a good shot of it, so we can show that device there, the new device that you got this week. We'll be able to get a better shot of it there while we still address this issue. What makes someone a good or bad candidate for this type of procedure?
Well, your best candidates are those people who have some fat to give. Some people, mainly Caucasians, will come in and they don't have any fat in the buttocks, they don't have any fat, lateral thighs, they have very little in the flank regions. You, like I say, you have to take it from someplace. You can't borrow it from your friend, which, everybody asks, but, their tissue's different, and so there will be a rejection issue, and it's just not the right thing to do. But a good candidate, they'll have fat in areas that they don't want it to be, like stomachs, flank regions, lateral thighs, medial thighs, and then they'll have a small butt. And so you can borrow all that and inject what you can, to get the size that they want.
I just thought of this, but if you're someone who's very petite and very skinny and also has a small butt, could you maybe make it your goal to gain weight? Could you chow down on hamburgers for 30 days and maybe gain 10 pounds and then harvest the fat? Would that be at all a healthy thing to do, or a reasonable thing to do, or you think that's out of the question?
Well, if you did that and stayed that same weight, then it'd probably be okay. But it sounds like if your goal is to have a larger butt and things, and you're harvesting fat, and you went to the trouble of gaining weight so you can identify those fat cells, and you put it in there, and then you turn around, well, I'm going to lose this weight, then you're going to lose it there too.
You're going to lose it from your butt too.
It is all about nutritional changes in status that influence fat cells.
Once you get the injections and you're all healed up, does it feel different, I guess, from the outside and the inside? Could you or your significant other feel a difference from the outside? And then can you do all the same activities?
There's really no difference in the feel. There's no difference in the feel, and you can do the same activities. Restrictions primarily are is that first week or so, in terms of you have to be, you want to work a little compression garment over there, because you want those cells that you injected to be fairly still. Because the stiller they are, the more likely is the blood vessels that are in that region will grow into that region to feed them. It's like if you broke a bone and things, and the goal is to keep your fractional line stable so that those things fuse together. If there's constant little wiggling in there and things, then they don't fuse right. Okay, they don't stay and they don't heal correctly. So the stiller you are the first week and things, the better off you are.
We talked a little bit about what happens if you lose weight once you've had this procedure, but if you gain, say you gained a lot of weight, you got pregnant, would your cheeks grow out at the same pace as they normally would?
Mm-hmm.
Yeah.
Yes, it would. In fact, I look at the fat in different areas of the body. They're actually different, even though they look the same underneath the microscope. They'll act differently. Like I said, the areas that people come in for liposculpting are areas that their body tends to take it up first and want to give it back dead last. Okay, and they want some assistance in getting that contour under control. So you're taking those cells that take it up first, give it back dead last, and you put it in the buttocks region. So that cell behavior still stays behind. So I would imagine that if they were to gain weight, they'd probably gain weight in the buttocks a little bit quicker than other areas.
That's good news. What is the recovery like? You said you have to be careful for about a week, but when do people start to say that they feel normal?
Well, they feel normal when the soreness goes away, and the soreness primarily will be from the areas that you extracted the fat from.
Okay.
The buttocks region, again, it's sore, but it's not. You're injecting fat into that region versus trying to disrupt stuff in the areas that you're taking the fat from. So there's more trauma really in the areas that you extract it from than where you're injecting it.
Do people ever say that it feels different when they sit down? I mean, someone who may have had like a bony butt before, do they feel like they have more cushion back there?
Well, they feel like they have more cushion because they do.
Mm-hmm.
In the areas that you're injecting aren't areas that you really sit on. The bony prominence that you sit on, the ischium is lower, and you'll inject some back there. So it'll probably feel like they're sitting the same. It's just that their clothes will be different, their bathing suits will be different because they're filled out.
What are some of the dangers associated with this procedure?
Well, very little. There was at one time a worry about fat embolism, which really never panned out to any real extent. I've never seen it. It's safe in that, again, you're using your tissues. You're not doing anything with heart, lung, intestines, things like that. It's just mainly subcutaneous fat. So as far as risk factors, liposuction or liposculpting and even fat injections have the lowest risk.
We ran a story on KTBS-3, I believe it was earlier this week, it may have been last week though, about a woman who wanted butt injections, and her friend bought some injections on the internet from a company that looked to have a very medical site. The stuff was on sale. She was going to be able to do it a lot cheaper. Ordered. My producer's telling me, it was bathroom caulk is what they actually bought. And this woman who, wanted to get a deal on this, she wanted to pay less. That was part of the reason why she didn't go to a doctor. Right. She let her friend inject her with what turned out to be bathroom caulk in her bottom, and she ended up getting a staph infection, and she lost her hands and feet. I was just amazed by that story, that someone would, order something off the internet and trust their friend to do this, but people obviously do it, and that story showed me that there are a lot of dangers of trying to go your own way on that. Talk to us a little bit about, have you ever seen that? Have you ever heard of that? People doing these types of procedures kind of on their own?
Now, I haven't heard of them or locally, but you hear the news, and there are medical grade silicone, that you can inject into areas to enhance them and stuff, and it works very well. But your bathroom caulk silicone is not a medical grade silicone. So again, you're just inviting trouble for that. It's like in the old days. I remember when I was a professor at the university here at LSU. There was a lady who came in, and she had actually breast augmentation using the old silicone oil injections. And this was back in the late 60s, early 70s, and she comes in, and the x-rays, mammograms, they're just nodule after nodule after nodule. You couldn't tell if she had breast cancer or had what's called granulomas. I mean, what happens is if you put a foreign body, your body can't get rid of it. It builds a little fibrous shell around it, and it's, if it gets real irritated, it's called a granuloma. And they feel like little hard knots, but her whole breasts, both of them were that way. And I had to do bilateral mastectomies and reconstruction, and even taking off the breast and stuff, the muscle was infiltrated with that silicone, and you just couldn't get rid of it all.
I want to talk a little bit about the implants. You're saying that this procedure, butt enhancement, is really moving toward the fat injections, but I would just like to touch on the implants just in case people have any questions about it. What can you use if you're looking to get an implant or a better candidate for an implant? I mean, what do you really use to put in there?
Well, they're implants similar to what you find with the breast implant, except they're shaped a little differently. They're medical grade, silastic or silicone, and they're soft. If someone's real thin, and some of the buttocks implant do have a little bit of firmness to them, you can distinguish between the two, between their tissues and the implant. So there is a feel issue with that, but again, it's not as common as it might have used to be in terms of the frequency of use. Again, most people are turning to the fat injections because it's fairly predictable. I mean, you don't know how much fat is going to take, but most of it's going to be about 70%. So you try to adjust for that.
Can the implants flatten over time or move around? Why are people moving away from that and more toward the fat injections?
Well, the implants can move, just like implants in the breast and stuff. The pockets around them tend to expand over time. I've had a couple of people say that basically it's a little uncomfortable, over a period of time to be sitting on them all the time, or at least having at least the back portion of the buttocks feel a little funny. The nerves to the skin over the top can change just because you're undermining that area, and nerves can be damaged.
What is the cost of the implants versus the fat injection?
Well, the implants, just as far as the implant itself, they're probably about $1,000. Maybe depending upon the types you need, versus they come in different shapes, so and the costs are different things. But and then putting them in, I mean, total is probably going to cost you $6,000 to $7,000 for the buttocks implant. It's probably a little cheaper with injections. Again, the injections seem to, because people will come in and they'll pay to get the place harvested, like a regular liposuction site, and then the cost of an injection and stuff is probably a little bit less than that.
How many people inquire about this here locally at your office? Is this something, I know you said before you do a lot of tummy tucks and a lot of, you have your procedures that you do a lot of.
Yes,
Is this something that's growing? It's growing.
I probably, like I say, about 4 years ago, it was probably one every month or two. Now at least I'm seeing probably about 4 to 5 a month, maybe more, for that specifically. Or if they're coming in for a liposuction, they'll say, well, what about the buttocks? And so it's really kind of included.
Can you get a butt reduction?
It's a good question. Yes, you can. The ones I've seen are those people who have lost a bunch of weight, and it's just the skin and things are sagging. And what you're doing is, they don't want to really lose much more fat in the butt, they just want the shape back to where it used to be. In those cases, you're doing kind of a skin reduction, you're preserving the fat. I don't have many people that come in and say my butt's too big and things, and even if they did, and I have had some, I'll tell them that you can't just do a bunch of liposuction on the buttocks region because the skin quality there is not the best in the world, and so you'd be trading one thing for another thing. So you can do butt reductions. It's not, as far as with the lipo or something, it's probably not the greatest idea in the world, depending upon their elasticity.
Well, you're obviously excited about this procedure, especially with the fact that you have this new device, and I didn't even realize, within this week. Just talk a little bit more about the benefits of this and why you're excited about being able to do it with this new device.
Yeah. The main reason is principle behind fat injections or any tissue transfer is the quickest you can get blood supply back to whatever cells that you are working with, that you've taken away from their normal blood supply and into an area, the better off you are. The take rate's higher and things. Number two, the volume of tissue you can extract and collect using this container versus a handheld 30 or 60 cc Toomey syringes is much easier, is much better. The ability to wash this is much easier than trying to take a Toomey syringe, take the fat out, put it in some water, in some saline, wash it up, then stick it back in there. So it's really a time savings, okay, as well as the fact that you can use and work with larger volumes of tissue in a more rapid response. You
talk about time saving a little bit. How many hours can people plan on being under the knife? I guess it's not a knife, but you know what I mean. Yeah. Well, the extraction and the injection, you're probably talking about 2.5, 3 hours, depending upon what they want. If they want other areas, liposuction, then obviously that's going to be more. Do people get put under general anesthesia for this, or just some numbing? Typically they do. We're doing some of these in the office, but right now I've been doing under general anesthesia. Like we'll do the lipo in the office by itself, the smart lipo and everything. Setting this up, like I say, it's just had about a little over a week, and it's a good tool. It's just that I want to get it right. Yeah. What can someone expect at a consultation with you if they're trying to figure out if they're a good candidate? How long does that take? What type of things do you talk about in a consultation for a procedure like this? Consultations are usually 40 to 45 minutes long, because I think you need all the details that go along with it. It will obviously talk about the Buttock Enhancement, where they might have a deficit, where they want it to be. They typically bring pictures, and I'll tell them we can do it or we can't do it. They bring pictures of what they want to look like? Mm-hmm. Sure. Yeah, I think that's not uncommon. And it's helpful because, like I say, the picture they may carry in their mind might be totally different than the picture that I think it should be. And sometimes people have trouble describing exactly what they want, so I'm sure it's easier to look at a picture. It is. I mean, it's easy for both of us. It just clarifies whether, like I say, some of these pictures they bring in, I don't care what you did, they can't have that. Yeah. Buttocks, and you want to clarify because you don't want to disappoint someone. You might as well say, we can't do that, or this is what we can do. Would you like that? And if not, then something else needs to come up. We got about 2.5 minutes left here. I think that I've asked all the questions that I can. Is there anything that you really want to drive home about the procedure, or make sure that people know, or something I didn't ask that you think is important? I think this is a procedure that, like I said, is catching on. It works very well. We work the kinks out of it as far as like fat grafting. It used to be fat grafting, it's a 50% take. Now it's in the 70% takes. And it's all in, the care which you take for extraction, as well as how fast you can get the cells washed up and injected back into the area where they're permanently going to live. What else is going on at Bridges to Beauty? What else are you excited about on the horizon? You always are bringing in, new devices, or talking about a new procedure that you've just worked out. What else are you excited about right now? Well, I mean, there's several things. There's some tattoo removal things we're looking at, because I think, what is it? 1 in 5 people who have a tattoo want to kind of get rid of it. I wonder who some of those people might be sitting on this stage right now. I know the feeling. Well, okay, yeah. But there's some technology that's coming around that will deal specifically with tattoos of all colors. That's been the whole trick, as well as some age spots regions. We've been able to cover those pretty good, but this also does the age spots too. Do you use the same thing for the tattoos and the age spots? Yeah, the concept behind it is called a Pico YAG laser, and the old lasers used to target the tattoos and heat them up to break them down. This just is so quick that it actually just busts the tattoo
I guess almost like stones and stuff, into finer particles quicker without the damage associated with the other ones.
Dr. Bridges of Bridges to Beauty, always a lot of great things going on there. Always excited to hear about what you have going on, and we appreciate you telling us about the buttock enhancement. I feel like I learned a lot. I was under the impression that people were still doing implants, but it's nice to find out about the fat injections where that procedure
Yeah,
is
this is
headed.
becoming much more popular.